Former Health Minister Zweli Mkhize ignored advice to use government communications and information system to roll out the National Health Insurance Communication Strategy in order to save money. The SIU's findings into the Digital Vibes contract shows that Mkhize went out of his way to ensure that the company was awarded a 150 million rand contract with the National Department of Health. Joining me now is Media Monitoring Africa's William Bird, who speaks to us from Johannesburg. Mr. Bird, thank you very much for your time. If you have read that report, there is a mention there of the Director General from GCIS who has deposed to an affidavit, which affidavit now sits with the Hawks. That brings the question about, in your view, what should have been the role of GCIS in standing its ground around this particular issue, because they were the people that were meant to conduct communications around NHI and the subsequent COVID-19 communications.
Hi, good morning. Well, I mean, look, to be honest, these things tend to be a bit of a mess when you're in the middle of a crisis, So what we saw at the start of the COVID-19 was a number of departments scrambling to set up communication systems, make sure that they brought different people on board, and there was really some incredible work done, right? So within the communication sector, you had a whole group of people that were meeting daily, then weekly, and now sort of once a month basis to discuss various issues relating to the communication sector, including communications around and about COVID, etc., etc. So that was coming from the communication sector. Outside of that, you then also had GCIS who participated in this, and then alongside them, you then had the NDOH that was running with their own process, running with their own ideas and their own tenders, and frequently, unfortunately, those two sectors didn't actually speak to each other. So you have a kind of a scenario where you've got people that are responsible for it running in this silo here, and then you've got others that are directly involved in the health crisis itself, running with their own systems here. And it's not necessarily in that instance anything to do with corruption as much as this is to do with how government tends to operate, that you've got the different departments operating quite firmly and clearly in silos, and it's always been the fact that this has placed the GCIS in a very difficult position, because they're meant to be there to kind of meet the needs of everyone and yet not meet the needs of everyone. So they kind of brought in, and then they've kind of told, no, don't worry, this is the department that's going to communicate this, whether it's communications department formally or whether it's water, energy, whatever they are, And that stems from the broader kind of absence of a more coherent approach to communications, unfortunately, which I don't think they've been able to systemically address in a really meaningful and coherent manner.
Yeah. We're going to go back to what the department in question, which is GCIS, was meant to have done here. I just want you to spell out for me, to your understanding, how GCIS, which is government communications, how it, in a way, coordinates communication with the various departments that exist, because that can only be the assumption that it exists in order to coordinate communication with all the government departments that exist to make sure that communication is done.
No, not just that it's done, but that there's a coherent set of messages that are emerging, and that you don't hear, one department saying something and then another saying something else on the same issue. So there is a clear need and value of doing that. The reality, though, is that very often there's, I don't want to say that there's a turf war, but there's certainly people's deliberate interest in terms of saying, well, we're going to be communicating these things. When you then get to kind of national policies that have been adopted by cabinet, where even though it's like the NHI, where it's tied to obviously Department of Health more broadly speaking, but it's still a national policy. That sort of thing you would think should then be within the purview of GCIS, not only being on the kind of various meeting groups, stakeholder groups that would meet to discuss how these things should occur, but also should be the ones that were probably directing that. But again, unfortunately, when you've got those, the way that government is set up to deal with these kinds of issues, it just isn't logical to an outsider, So frankly, we don't know as outsiders quite where the mandate of GCIS begins and where it ends, where the mandate of each of the departments begin and end when it comes to communication. And so that makes it very difficult within this particular example now to say it. Here, when you then make it more complex by saying, well, actually, what you're going to do is give jobs to pals, because that's essentially what happened here, and that's rank corruption, then, you've got the people at GCIS going, I think we're meant to be doing that, but actually it seems that now these other people are doing this.
Yeah.
And, so your people within GCIS are sitting there going, they don't know, because there might have been some other thing that either they missed or they know that there's something there and they just want to go, I don't want to touch that. I don't want to be involved in that, because there's also then within the government departments very often a fear and a heavy reluctance to take big decisions on things. So people would then go, oh, well, okay, they've taken that decision. What we're going to do is we're going to just sit by and wait, keep our touch powder dry, so to speak. Are we going to just see what happens? Because we don't want to be putting our necks out to be starting to say something that's different to this department, because they don't want to be in trouble or whatever the case may be. So there's this. So when you're in that environment, that kind of reluctance to be seen to be wanting to take decisions, plus all the hectic politics, ministerial and interdepartmental issues that are going on, you can understand how those kinds of things easily occur,
Yeah. William, we know based on the report that has come out that Cabinet had taken a decision that communications around NHI and COVID-19 would be done by GCIS. Unfortunately, the report doesn't go further than what I've mentioned earlier to say the DG at GCIS was asked to depose to an affidavit which now sits with the Hawks, working on the assumption that in all probability there must be or there should be some kind of correspondence between GCIS and the Health Department to say, you're overstepping your mark here. We are supposed to be doing this communication. If it is found that indeed that paper trail does exist, will it put a further nail, not just on the officials like Dr. Anban Pillay, but people like the health minister, for example, should it be found that there was email correspondence, for example, going between the GCIS and the health department around this?
Oh, I'm sure, but in such a confusing environment, that's going to be the least likely, strongest evidence to provide those nails. My sense is that the SIU report in itself provides more than sufficient evidence for those nails in those coffins, but it does point to the bigger issue. So yes, GCIS was responsible for that COVID comms, right? So you've got GCIS for the communication around COVID. So you've got GCIS, their people working around the clock doing all sorts of amazing things. Let's be clear, it's not like they were sitting there and just, twiddling their thumbs. These people working, easily 20-hour days on a consistent basis trying to get things in order. But then you've also got the presidency within their own kind of purview and the kind of things that they need to be addressing. And then you've got the MAC, around his emergency committee and ministerial team that sits and also talks to COVID, and they're doing some of their own communications. Then you've got the NDOH and you've got comms, right? Each of them are having to say and report back to Cabinet, this is what we've been doing around communication. So within that framework, it's, it's just so easy for things to slip through, for people to say, okay, I didn't know that this this, or we were just doing this as part of our mandate. So just because GCIS was responsible for communicating around COVID, as an example, right, doesn't mean that the other ministers weren't sitting there saying, well, okay, we're going to just leave this up to GCIS. No, no, no. They were, especially within the communication sector, they were saying, well, what's our contribution to fighting this? What are we doing? How are we communicating? And so they were doing their own initiatives, you know. So they were speaking to the mobile operators, put out WhatsApps with good COVID educational content on it. They were doing all of those things. GCIS, theoretically, and in many instances, did have their kind of eyes and ears on that, but it just meant that you've got a whole series, and you can see this now, the effect of this, in the kind of vaccination communication that we've got. So you've got a whole bunch of entities that are still doing quite different vaccination plans and communication strategies, and yet there should actually be one. So that's not about communication. That's just about, I mean, that's not about corruption. That's just about the way that our government has failed, you know, for the last 2 decades to set up a coherent, you know, communication system and strategy. Remember that part of state capture project was that you destabilized just about every department. So GCIS has had, you know, acting people operating it for the longest time. Then it was seen as this kind of stooge of this ability to push and offer any kind of counter-narrative to all the disasters that were happening. So within that kind of system, you then move straight from that into a massive global crisis. And it's no wonder the wheels are going to fall off in a whole range of places.
Yeah, well, good thing that COVID-19 is such a global pandemic that government, alongside the scientists, they have all been trying to push out information about the efficacy of the vaccines and just how safe they are. So that has almost been forced on the department and government as a whole to communicate around that. But as far as NHI is concerned, how much have you heard? How much do you know, for example, as to where that process is right now? Because perhaps that will talk to whether or not this has been money gone to waste and these monies needing to be recouped.
You know, it depends on whether you're talking about a public awareness campaign, whether you're talking about strategic communications around the NHI and which department's been responsible and to what extent has GCIS been doing things. You know, to be honest, it seems NHI has clearly taken a back burner in relation to COVID and trying to get, you know, communications around that on a single coherent kind of policy and plan. And that in and of itself is proving to be an incredibly difficult task. As it is now, we know that the NDOH has been given money and budget to actually do other public information and awareness campaigns about vaccines, and that hasn't gone to GCIS, that's gone to NDOH. So already within that same framework, saying that they're responsible for it, NDOH are firmly part of or in charge of at least some of those elements of that, and then you've still got GCIS there trying to help and make sure that all of these things stay on message and trying to communicate then with the Ministerial Advisory Committee.
Yeah. William Bird, thank you very much for your time and your thoughts around this matter. He is with Media Monitoring Africa.